Good evening, Los Angeles, and thank you again for joining me here at Los Angeles City Hall. I know that these have been extremely tough days, and they're full of sadness, they're full of fear, but I hope that today you found a moment of joy, of smiling, of laughter, of connection, a reminder of the most important thing in the midst of this, to connect with one another and to know that we are stronger when we are all together. But there's no sugarcoating the news. These headlines are tough. Today, we learned that 1 in 10 Americans have lost their job because of the COVID-19 crisis to date. It's a devastating number, and it's more than a number. These are people, those watching right now, who have now lost their livelihood, who are scared about the future and not sure what tomorrow holds. But through these hard times, I want you to know that we are here to support you. We see you, we know what is happening, and we are doing everything we can to make sure, whether it's at the national level, state level, or here locally, we are here to get through this together. Mayors around the country have been monitoring data that helps us understand how our communities are responding to the changes and the moves around our cities as we work together hand in hand to address this crisis. And we've seen a significant drop in movement. That's because of you, and I thank you for that. It's a sign that folks are abiding by our stay-at-home order, and that is exactly what we need to see. But based on a sample of movement data, we know that Angelenos are still visiting certain places of recreation, and many folks are visiting places of worship. In fact, while it's good news to see a 69% reduction, still 31% of the sample are visiting churches and temples. Going into the holiday weekend, I want to remind you how important it is to stay put, that it is okay to participate. In fact, we encourage you to connect with services online, to listen to a sermon, to hear from religious leaders, but we need to make sure that we do that from a distance. That's how we will keep deaths down. These moments that we commemorate in this Holy Week and in the weeks ahead, we need to make sure that we are not adding to stories of tragedy, but that we are marking them and saving as many people as possible. So let's get to the numbers. Today in Los Angeles County, there were 425 new cases, bringing the total to 7,955 confirmed positive cases of COVID-19. This is just a 6% increase since yesterday, and that is the smallest increase we have seen since we've been tracking the statistics. It's good news, and the 4th day in a row of single-digit increases. But remember, every day we are getting more new cases than we got in the first 3 weeks. So hold both of those numbers, that our work is producing a slower rate, but that we still have some of the toughest days ahead of us. In the city, there were 227 new cases, bringing the total in the city of Los Angeles to 3,587, also a 7% increase. And we learned today, tragically, of 25 new deaths, bringing the number total of deaths to 223. Those 25 deaths are the 3rd highest number we have seen, and it was a 13% increase since yesterday. Our numbers of deaths are still doubling every 4 days, and our hearts go out to those families who have lost 25 different families who are mourning the loss of a loved one for the first time, and the other 198 who have still been mourning during this crisis. I know we get numb to these numbers, but let us not be numb to the families and the people behind them, each one who can never fill that hole, but we will remember them, and we will do everything to try to ensure that there are fewer numbers in the days ahead. Hospitals continue to save lives, and I thank all of our hospital workers that are doing such amazing work to treat those that are sick and to prepare for more that will come. The more lives we can save, the more we prepare for the peak. So let me share our hospital bed numbers with you. Across the county, our general emergency hospitals have 1,641 available beds, including 268 ICU beds, and an inventory of 971 available ventilators. Testing, we know too, is the other weapon that's absolutely critical in our ability to not just flatten the curve, but eventually to see that curve bend down. And 3 weeks ago, when there were very few tests available, we acted on our own to provide tests to first responders and to medical personnel. And then we expanded that quickly to residents, administered by our fire and our personnel departments of the City of LA, and now together with county workers as well. We opened up testing earlier this week to anyone in the county that has symptoms. Today, we set a new record, testing more than 4,000 people in our city and county. These were scheduled through our website, and of course, there's more tests being done directly through providers. But we blew past our goal through those drive-through and walk-up centers of testing 30,000 people. We hit that one day ahead of schedule, and here's even better news. We're aiming to double that number to 60,000 by the end of next week. Even if slots are filled for a given day, I want to remind folks who are viewing that many open up because we always have a few people that don't show up. So check it out. If you can't get into one date, you'll be pushed to another date. And you go to coronavirus.lacity.org/testing to see if you qualify for a test and to get yourself an appointment. The reality is some folks cannot go out, though, to get tested. So we need to go to them. Yesterday, following the news of COVID-related deaths at the Motion Picture and Television Fund nursing home, our LAFD testing team deployed to that facility, where they tested more than 100 seniors and employees right away and another 60 today. We have a responsibility to keep the most vulnerable who live amongst us, our seniors, our grandparents and parents, safe. So tonight, I have a good announcement to make in that realm, that beginning now until this crisis ends, the city will deploy a rapid mobile test team that will go to these facilities that are housing the elderly, chronically ill, or debilitated, nursing homes, skilled nursing facilities, assisted living facilities, and respiratory hospitals. And if one of these facilities has a symptomatic resident or sees the start of an outbreak, we will send a testing team there as soon as possible to stop the spread and to help save lives. And we've set up a new website to help facilities get the testing that they need. So let me share that with you. That's coronavirus.lacity.org/assisted living. Everyone has a right to be protected in this crisis, and they shouldn't have to fight for that right. I also spoke last night about the disproportionate impact that we're seeing across the country of deaths on the African American community. And I'm proud to say that we have doubled the capacity at our Crenshaw Christian Center testing facility in South Los Angeles. It's not enough to identify a problem. We have to take swift action to save lives, and I hope this is an example across the country of making sure that no community that faces tougher health indicators will die because we did not react to the numbers that we saw. Thank you to the county for sharing that, and thank you to my testing team for ramping that up so quickly. Today, workers at 30 fast food restaurants across California walked off the job to demand that their employers provide proper health and safety protections. And I want to remind employers that they have a responsibility to protect their workers. My worker protection ordinance requires that all employers provide face coverings for their employees or reimburse them for them, the opportunity to wash their hands or sanitize every 30 minutes, clean, fully stocked restrooms, physical distancing measures between employees and anyone else at the establishment, and hand sanitizer at key touch points. Additionally, all customers who enter restaurants, markets, and many other businesses must wear a face covering, and this is not negotiable. This is a matter of people's fundamental right to be safe at work. I've loved hearing everybody thank every worker that is out there, whether they're working in a fast food establishment or at a grocery store, in a hospital, or responding to a 911 call. But let's make sure those aren't just words. Let's protect those people so they don't get sick and so that they don't die. Driving to City Hall each morning, I can see that Angelenos really are taking to heart the facial protection order. Thank you for doing that. But one last reminder that the worker protection order goes into effect officially this evening at midnight. So face coverings will be mandatory whenever you go to shop or work at a restaurant, store, market, hotel, laundromat, or pharmacy that is open, whenever you ride or drive in a taxi or rideshare, and if you're working on a construction site or with a delivery service. We know that during this time of crisis, many individuals and families are in need of services, and support isn't just coming from the city. Your county is here for you too, and I want to thank our Board of Supervisors and each of the county agencies that's stepping forward to help. My wife, her first job when I convinced her to move from the Midwest here to Los Angeles was at the Department of Public Social Services. And those employees do work long before COVID-19 to help address poverty and provide opportunity for our residents. So if you're struggling to put food on the table right now, the CalFresh program is there through DPSS for individuals and families. If you're having a hard time making your ends meet, there's a General Relief Cash Assistance Fund for single adults. There's a CalWorks Cash Assistance Program for families. And the Cash Assistance Program for immigrants that covers aged, blind, or disabled legal non-citizens ineligible for supplemental security income, as well as refugee cash assistance for refugees, those who have found asylum here, as well as trafficking and other serious crime victims. Health coverage benefits have never been more important as well, and this department can help you make sure that you access or enroll for Medi-Cal during this critical time. So don't wait till the last minute to access these benefits or to find out if you're eligible for them. Please, tonight, if you need help, go to dpss.lacounty.gov or call 866-613-3777 to ensure that you have the coverage and support you need. The county also provides critical delivery services for seniors, dependent adults, and disabled Angelenos. And if you need that sort of help, you can call 888-863-7411 to schedule free delivery of groceries, household items, and vital necessities. And I want to thank everybody who's doing this, whether it's neighborhood councils, whether it's some of the food supplemental organizations that help to deliver, and our food banks as well. And you can receive through the county program up to 4 deliveries per month, and I encourage all eligible Angelenos to sign up and take advantage of this service. And with this crisis hitting our elderly and our disabled communities especially hard, the Department of Public Social Services also offers in-home supportive services so that you can stay safer at home. Anyone in need of these services can apply right now for them by calling the In-Home Supportive Services application line at 888-944-4477. I've made it very clear from the beginning of this emergency that this is a local emergency, but that we are not shutting down critical government services. Your city government is up and running with water and power, street cleaning, law enforcement, transportation. All the basics remain and will remain covered. One of those core functions is picking up the trash. I've always said we need to get back to the basics, and I'm proud of our sanitation workers who are doing that day in and day out. And I want to thank all those city workers who are showing up and fulfilling their duty to serve our city. And that work could not be more important because after 3 weeks staying safer at home, a lot of folks are seeing more waste and recyclables that are piling up. So tonight I'm announcing a new effort for the 750,000 single-family homes and many of our apartments in our city that are serviced by our sanitation department. We will temporarily offer free extra collection on those black and blue bins on your regularly scheduled collection days. So here's how it works. If you have extra bags of trash or recycling that don't fit in your bins, we ask that you meet the truck outside when it arrives. So you can hear the truck long before it gets there. Our drivers will stay in their vehicles and customers will have to abide by the proper physical distancing. But once your bin is emptied, you can refill it while the team is there and they will take that in as well. Simply put, we're doubling down on picking up your trash. And of course, this is free. You won't be charged 1 cent more for this. I know it's not a perfect solution, but it's the creativity that we're trying to add in a very difficult moment to make sure as more people are eating at home, staying at home, that we can lighten the waste load that you have while protecting the health and safety of our workforce. So this is free of charge. It starts on Monday and lasts until the Safer at Home order is lifted. And if you have any questions, please call our sanitation department hotline 24 hours at 1-800-773-2489 or during work hours, call 311. Throughout this crisis, we're constantly evaluating better ways to serve Angelenos while keeping you safe and our city services going. So in order to continue providing excellent care for our city's animals and protect our staff, we're consolidating our animal service care centers. And beginning this Monday, April 13th, the department will close its West Valley and North Central Animal Services Care Centers. The animals housed there will be moved to one of the 4 that remain open. That's the East Valley, the Harbor, Chesterfield Square, and West Los Angeles Animal Service Centers. This is possible thanks to an outpouring of love from all of you for these animals. Last month, you helped us place 307 animals in foster care, found homes for another 919, and placed 752 with rescue partners. Simply put, these numbers are off the chart. And there's never been a better time to foster or to adopt, so nobody should be lonely. And if you want to have a great friend join you, we're encouraging you, and we're available for adoptions to go and adopt. Animal Services has a long list of folks wishing to foster, but you can jump that line if you're willing to adopt. So please visit laanimalservices.com/adopt or call 888-452-7381 and have the animal ID number ready from our website, and we will make sure that we guide you through the application over the phone, schedule an in-person pickup appointment between 11 a.m. and 4 p.m. at one of the open centers. It'll be a great way to get through this and to help an animal in need. During these briefings, we regularly highlight the work of the Mayor's Fund of for Los Angeles, which has been a central hub for our city's response. We're collecting and distributing donations to fill critical needs, whether that's meals for newly isolated seniors, whether that's shelter for domestic violence victims, childcare for parents who are working on the front line in hospitals, or direct assistance, cash assistance to Angelenos who are experiencing financial catastrophe. Make no mistake, as we share the news, good news about new contributions, that doesn't mean that we are covered or that we have all the donations we need. It's actually the opposite. Let me give you one example of how we're putting these funds to use and why they're so desperately needed. On Thursday, our city's Family Source Community Centers began distributing $1.2 million in grocery gift cards. In just 4 days, they were gone. Our supply was completely exhausted, and we helped 10,000 Angelenos get groceries that they badly needed. And let me thank the staff at our Family Source Centers who are working in this crisis. They rose to the occasion to manage a completely new program and to get this help out the door as quickly as possible. It's a tremendous example of the city and nonprofit workers who are going the extra mile to help our fellow Angelenos. That's good news, but it's also a reminder of how much need there is out there. And tonight we received a generous gift to help us with some of our most important work. We've all been following stories about domestic violence during this crisis, and most of us are safer at home during this pandemic. But for folks who live in a dangerous environment domestically, this can be a dangerous time. LAPD has reported an increase in calls, and the Los Angeles Housing Authority has determined that approximately 90 victims have been turned away from LA's domestic violence shelters since this crisis began. That's unacceptable for all of us. These shelters are full not because of increased demand, but because they are intended to be temporary, and the Los Angeles shelters normally house victims and their children for 30 to 45 days. During that time, they do incredible work. They work with specially trained staff to address the trauma of these victims, stabilize them, and either return them home, move them to alternative housing with family or friends, or place them in transitional housing. But because of this pandemic, victims right now are frozen there instead of being able to move through those shelters. And as a consequence of this public health emergency, there is no movement to different living situations. The unfortunate fact is that 1 in 4 American women will experience domestic violence in their lifetime. And make no mistake, men are victims too. In Los Angeles County, women who have been victims of domestic violence make up the largest subpopulation of our homeless population. On Skid Row, one study said that 91% of women on Skid Row were the survivors of sexual and/or domestic violence. So we need a surge in shelter capacity. 2 weeks ago, the Mayor's Fund for Los Angeles quickly responded with funds to pay for hotel rooms and meal stipends for 80 families that were suffering from domestic violence for 15 days, an example of how funds are going quickly to fill needs. But on Monday, we will need additional funds to continue sheltering 53 of those families, not to mention new funding to deal with the increased cases, which is why I'm so pleased tonight to announce a donation. And I thanked Rihanna once already, but she stepped up a second time. But Rihanna's Claire Lionel Foundation and a new donor who's been helping us, Jack Dorsey, together are co-funding a $4.2 million grant to provide 10 weeks of support, including shelter, meals, and counseling for individuals and their children who are suffering from domestic violence. Their generous support will cover housing and food for 90 domestic violence victims per week, with an additional 90 victims every week thereafter for 10 weeks. And all I can say is thank you. You are truly angels, helping this city of angels. Jack, Rihanna, you are helping save lives in more than one way, keeping people healthy and making sure that they are safe. So if you can afford it, please, every dollar counts. Go to mayorsfundla.org and chip in whatever you can. Crisis or not, that kind of generosity is part of who we are. And so is gratitude. When we see neighbors who are helping neighbors, when folks answer phone calls as volunteers, when they go to a food bank and help our seniors be fed, people have gone above and beyond to lift up people in need. And I'm so proud to be the mayor of this city, so proud to just be a resident of LA alongside you. There are so many essential workers on the front lines of this crisis, and right now all of us are doing our part to protect public health. But no one is doing more than our healthcare workers, those doctors, nurses, medical technicians, janitors in our hospitals, those folks that are on the front lines treating patients, risking their own lives to save others. And I want to thank them all. I had mentioned Wet Design. Mark Fuller, who's the CEO, he called me today and he's donating some facial shields to help those workers and some of our grocery workers. But our medical professionals have just been extraordinary. And we've seen a movement around the country and around the world to thank them. And we want to express our thanks tonight in Los Angeles. So tonight you will see City Hall, hopefully on a TV screen, don't come in person, that lit up blue, as well as a way of us saying thank you to our national healthcare workforce. This is part of this national campaign that's been inspired by a global movement. And you're also going to see the Convention Center, LAX, LA Live, the Coliseum, the Music Center, Staples Center, Bank of California Stadium, and so much more join in tonight. There will be literally blue everywhere. And I know many of you have already started doing this, but if you want to do your part at 8 o'clock tonight, open up a window or open up your door and applaud these workers. Applaud so loud that they'll hear them coming back from a shift or going to an overnight shift. They'll hear them in a hospital or a clinic someplace close by, or in their apartments or homes as they've come to rest their weary feet. One voice, united as a city and a community, we say thank you. You are the ones who are saving our lives. It's the same thing that we can do every single day when we commit to being safe. So stay healthy, stay safe, and stay at home. Thank you, Los Angeles. And with that, I'd be happy to answer questions.
And our first question comes from the line of Alex Michelson from Fox 11 News. Please go ahead.
Hey, Alex.
Hi, Mayor. Congratulations on what seems like some good news and some progress when it comes to the numbers here in Los Angeles and also in California writ large. What is your thinking? Walk us through your thinking of when you will think, now it's time we can start going back on some of this stuff, start easing some of these restrictions, because there's so many people that are so eager for that day to come. And secondly, just listening to your voice, it sounds like, are you a little under the weather? Are you doing okay?
No, I'm fine, thank you. No, I'm all good. My daughter has a non-COVID-19 cough, but besides that, we're all doing well. So a couple things. And now that you said that, I have to clear my throat, of course. I think you hit the nail on the head, Alex. It is really tough because what I've tried to communicate to Angelenos is a mix of kind of your high school sports coach and Debbie Downer every night. I want you to feel encouraged, but I want to be honest about the bad news too, because I think the bad news steels us for what's ahead. And while it's true we have a better number, the last 4 days, single-digit rate of increase, it's still increasing. And the base is bigger. So even any increase off a bigger base means hundreds of people, where we used to say it was just a few or a few dozen people. That's really a tough thing to face, knowing more people are going to be dying in these coming days, more tragedy. Second, we see even in some of the places that did really well early on, I was just reading about Singapore, we're seeing it maybe in Wuhan again, in South Korea, that places that kind of had not only bent the curve down, but flattened it, they now are seeing second waves. It's still not clear. In some places, there's evidence that people who have gone through this once and who we would think would be immune because of the antibodies are getting a second positive. So we really have to follow the medicine. We really have to follow the doctors. We really have to follow the data. And not just as we've always done and we want to follow our hearts. This is a tough challenge because, as I said from the beginning, when it feels wrong, it's the right time to do something. By the time it feels right, it's too late. Or when it feels right, it may be too early, I'd add to that. So the idea that we will suddenly emerge I don't want that to happen if that means a second wave of deaths or the marvelous work that we've seen here in Los Angeles by being ahead of many of these actions, in California by being the first state to have a stay-at-home order, that somehow we would see that reversed. And I believe I shared last night with you the story in 1918 in San Francisco, where they did a really good job with the influenza epidemic. They declared victory, came out, and had a sudden and severe onslaught a second time that resulted in a lot of deaths. So we are talking to a lot of folks, but until we have tools that maybe didn't exist 100 years ago, but the tools of being able to test people with the blood tests, figuring out the workplace environment rules, something I'm talking to mayors around the country and doctors to, as well as, of course, our county public health. We're going to think really hard about that moment. We know, have some weeks before we would even contemplate having this order lifted. So with that in mind, we hope in the next few days to have a better idea of that, and we're watching around the world. Those places that went first, had success, but are now seeing some backtracking of that. What lessons can we learn from that? Thanks, Alex. Next question, please.
And our next question comes from the line of Claudia Pashuta from KNX News Radio.
Hey, Claudia.
Hi, Eric. Wanted to ask, the LA Times did a story today about the difficulties of people on the streets trying to get face masks and wash them. And so I wanted to ask you about that now that the order is due to take effect. One of the concerns that was raised in the story is that, you know, some people may not be allowed to go into laundromats and other essential businesses without masks, which would make it virtually impossible for some homeless people to wash their masks if they can get them, or get food or whatever other items they might need. Right. And also, I'm wondering what steps the city might take, and along with county public health, to track any outbreaks among homeless people on the streets. We know that there are some institutional investigations involving shelters, but what can be done to track something like this?
Yeah, thank you for both questions. From the beginning, we've been very concerned in the street, and we've moved, the Homeless Services Authority has moved away from just educating people on the street to now doing wellness checks. As I announced yesterday, we now have testing through clinics that our unhoused Angelinos regularly go to, with doctors who work with people who are experiencing homelessness. And we saw hundreds of those go out just today alone. And the masks or the facial coverings, we have 35,000 that we have ordered that we can distribute on the streets. Some of that has started as well already. And in terms of the sanitation, on top of the 300 plus wash stations, and as I said yesterday, I wasn't happy that those were being serviced every week. We talked to the provider of those, and now those are going to be filled and checked daily, not just by them, but also by our sanitation workers. So a double check on that to make sure that people can wash those things, can wash their hands, can be clean as well. In terms of outbreaks, remember we've had per capita more COVID-19 cases among people who are housed than people who are unhoused. That said, absolutely, the public health direction we had, whether it was in existing shelters or the new congregate shelters, or even as we move people into hotel rooms and motel rooms, are when we know where people are, we can track them and it can be safer. So for instance, in Granada Hills, I know it was in the news, there was somebody who had tested positive in the shelter there for COVID-19. The system worked exactly as it's supposed to. If they had been out on the street, we wouldn't have known. That could have spread. It could have been a cluster, but instead they were immediately quarantined. Others were tested, the place was cleaned, and folks were able to be restored there. So we have never envisioned a world in which anybody who's housed or unhoused won't get COVID-19. It's about how quickly we can respond. And thanks to the county, for instance, at the Granada Hills shelter, here at Skid Row at one private mission, they immediately have full-time people who are there to monitor and to make sure that, as with jails, as with other congregate settings, that doesn't become a cluster. So far, so good, knock on wood, and we're getting those masks out. Next question, please.
Our next question comes from the line of Jory Rand from ABC7. Please go ahead.
Hey, Jory.
Hey, Mr. Mayor. Thank you very much for taking our calls again. I really appreciate you mentioning that cheer that's been going up every night. It's been pretty special to see that happen in downtown in different neighborhoods. So thanks for addressing that. I do want to ask you about, I know you addressed that blood testing, the antibody testing a bit yesterday. We were at a private drive-up testing facility today where they were charging people about $100 to get that antibody test. Is there any oversight of these private facilities? Is there anything people should be wary of when going to one of these sites? And if someone does show positive for the antibodies, that they at some point had the virus, is that still added to the count of those testing positive for the city or the county? And also, I just want to ask you real quickly about the rapid mobile test team that you mentioned earlier that would show up at a place, a facility where there's an outbreak or a patient who's showing symptoms or test positive. Would the city or county be involved in the next step? Would it be evacuating that facility? How would the city and LA County be involved in what comes next after a positive test is found at a facility like this? Thank you.
You bet. Thank you, Joy, and thanks for your words, too, about our public health and health professionals. Let me start with the second question. So the guidance when this happens is, of course, in any of these congregate settings, our marvelous Department of Public Health has staff standing by and that are just focused on congregate settings. So they can bring somebody. It's not necessarily to evacuate folks. Obviously, if it was a huge explosion, that's something to consider. But it's really getting rid of the folks who are there with that and putting them in quarantine. This has been part of the hotel and motel program that the county has. Isn't just for folks that are living on the streets who are experiencing homelessness who don't yet have symptoms. It's also for folks, whether you're housed or unhoused, who do have symptoms and have no place else to go, who have been confirmed as positive, so that those can be isolated, those folks can be prevented from spreading further. And then there's usually a public health professional, as I mentioned at Granada Hills Rec Center, who will then stay there ensuring that everybody else is okay. In terms of some of the places we've done this, I mentioned the Motion Picture Home, the Jewish Home for the Aging out in the Valley had some worries and had some positives. And it's not exactly a concierge service, but working with places that have medical professionals, we're able to get these kits. Some of them are through the partnership with UPS and Everlywell that I mentioned, and we can get them free transportation there. They get them, their medical professionals, and this team would immediately be able to help them make sure that they are taken and get them out of there that day to be processed in a lab. So it's a quick process, and in terms of the availability, those hotel rooms and motel rooms that are available right now, there's more capacity than people in them. That's where people would go. Secondly, in terms of the blood tests, I'm glad you raised this. There is no way for us to regulate the private entities that do this, and there are many private providers that are doing testing, both virology and serology. Virology tests are the right tests to know if you have it right now and you're infectious, whether you have symptoms or not. Obviously, we don't have enough tests yet to do that with people who are asymptomatic, but that will tell you whether you are sick and contagious right now. The serology or blood tests will tell you they can tell you whether you have it or whether you have had it, but they're not as dependable for whether you're contagious. So in other words, you may be contagious, you may have the novel coronavirus in you, but you don't have the antibodies yet that would be something that the blood test would catch. So as such, it's not a dependable test to know whether or not you can infect others. It's a good test to know whether you've had it. In terms of the price of this, I hope that our national government will exercise leadership to make this free for everybody. And if we can't make it free for everybody, make it free for those whose employers won't pay for it. I think for us to get people back to work, back to school, et cetera, we're going to need, school nurses, employers, others to have these blood tests and at least see whether people have successfully had this and survived it. With the caveat that I mentioned, we don't know the data yet. You can get it a second time possibly, even if you've had it once before. So we have to wait for that science. These blood tests are useful. They're most useful in seeing what the incidence is out there. Has there been 2% of the population, 5% of the population, 10% of the population who's had blood tests? So that's where we focused, paying for some blood tests ourselves because we need to know that information. In the meantime, we're putting all of our money into the virology test that can tell us if you're infectious right now, because that's what we need to know to isolate you and to stop the spread. Hope that explained both of those. Thanks so much. Next question.
Our next question comes from the line of Steve Gregory from KFI News. Please go ahead.
Good evening, Steve.
Hey, Eric. Good evening. Quick question about some interesting stats that had come out of Dr. Ferrer the other day about the rate of cases in the African American community, and there was a concern about that, and it was disproportionately high. I'm wondering if you've got any kind of a plan to do any kind of aggressive testing or any kind of a program that might target those communities and get them some help in that respect. The other question I have has to do with homeless encampments. Now, we're getting a lot of feedback from listeners that some of these areas that have encampments, people are getting attacked, approached, still panhandling, that kind of thing. They're worried about the social distancing that's not being adhered to by that community. LAPD's involved, and apparently someone from Councilman John Lee's office had told these individuals that basically the city has to be hands off, the police has to be hands off, and they can't really do much about it. I wonder if you could comment. Thank you.
Sure. Let me start with that. I've always been very careful to say, look, we've got crime, people that live on the streets and people who live in homes. And nobody's status in terms of whether you're housed or unhoused will protect you from criminal behavior. So anybody who thinks, and there's always these rumors, and I've said it to the chief said it to every single officer, we will go after crime wherever we can and wherever we see it. And nobody is immune from that simply because they're housed or unhoused. On the flip side, it's very important to remember that, not everybody who's homeless is somebody who has a mental health issue, a substance abuse issue, and/or who is a criminal. That in each one of these, when we do plenty of polling on this, we see plenty of surveys on this, this is a minority of the people that are out there. But where there are those incidents, please do call LAPD, 1-877-ASK-LAPD, or if there's something that's happening, a crime in progress, call 911. And there is no sort of immunity to that at all. We can't be all places all the time, but whenever there's violent crime, property crime, those things. Right now we've seen a drop in crime during this, a pretty dramatic one. We have resources available. This is not a public safety emergency where we have to restore order. So we do have those resources and we can use them. So please do contact either your local station, your local division, talk to your senior lead officer, or just call that hotline. In terms of the African American community, I mentioned this a little bit in my comments, but let me go a little bit deeper. Yes, it was not enough, I said, to identify this problem that we see in Chicago, Michigan, where sometimes our statistic was 9% of the county population, 17% of the initial data we had in terms of deaths were in the African American community. Really three reasons, and I highlighted two of these yesterday. One is that we've had disproportionate health limitations in the African American community, the impact of years of racism, the impact of poverty. So many of the underlying indicators that can cause somebody when they get the coronavirus to be more likely to die disproportionately exists in those communities of color and low-income communities as well. I bet if we did the same thing for poorer people, wealthier people are going to survive this with the same symptoms more than folks that are poorer. Second, I shared with you part of the things from the LMU poll, which we'll be sharing some more about tomorrow. I know some folks asked about that, and tomorrow we hope to be able to share quite a bit of that robust data with you, or over the weekend. We saw that of all different ethnic groups, that African Americans had the lowest percentage that were extremely worried that they thought that they would get COVID-19. It was 35 or 36% at the time versus about 50% on average. So I said a very loud and clear message that this affects everybody. Don't think that it won't affect you because you're young. Don't think that it won't affect you because of where you live. It is universal. And third, we have also in that same poll, it was very interesting, African Americans were less likely to have lost their job or their hours. And that's a reflection, I think, of how many African Americans work in these critical professions that are on the line in government and other places, whether it's your postal delivery person, whether it is a city worker, whether it's somebody who works in a hospital or drives a bus. African Americans are more likely to be in a dangerous work setting right now because they are well represented in government jobs, and we thank them, and that's why we have an obligation to make sure that we don't just highlight this, but that we do something about it. So yes, as I mentioned in my remarks, we doubled down in the testing center that was closest to the largest population of African Americans in the city, that's run out of the Crenshaw Christian Center, and we've doubled the capacity in a matter of 1 or 2 days. So that the testing there, I think more tests are going through there than anywhere else, because I want to make sure that this statistic isn't one that lingers here and that we don't just give lip service to saying this is bad, but we actually put our actions into saving lives and making sure that all the lives that are out there matter equally. Thank you.
Thanks, Eric.
Next question.
Our next question comes from the line of James Preston Allen from RL Newsport of Los Angeles. Please go ahead.
Hey, James, how are you?
Mr. Mayor, how are you today?
Good.
I wanted to ask you something about the business community.
Yes.
Throughout the city of Los Angeles, we have multiple property-based business improvement districts. And I'm wondering whether or not you have elicited their help in helping to alleviate the difficulties that all of the small businesses are going through with the closures or partial closures of the restaurants, bars, and whatnot. Each of these property-based business improvement districts are authorized by the city of Los Angeles, and I'm wondering if you've asked them to participate in relief programs for rent relief for their tenants, or for any other help that they might provide to back up what your good efforts that the city is doing to help support small business.
Yes, thank you for the question. We absolutely have been in contact with the business community and business improvement districts. They've helped, whether it's in Hollywood, the Hollywood Entertainment District, going above and beyond to help us with our sanitation efforts on everything from, pedestrian crossing lights, buttons, to looking at street cleanliness, to making sure that we do everything we can to keep our public spaces less likely to spread the COVID-19. That's one thing they've done. Two, absolutely, a number of them have stepped up. Again, this is Business Improvement District is a self-tax of the same businesses that are suffering right now. So I know many of them have looked back at what they could do to return some of that money, help out businesses. It's both sometimes property owners and sometimes it's a Business Improvement District of the businesses, not the property owners. There's two different kinds. So it's much tougher for these ones to who are already hanging on, or some of them have gone under, to use their own money, obviously, that doesn't exist. In terms of rent relief, no, we haven't reached out specifically to that, because usually the bids budgets are quite small compared to what the need would be, I think, across the bid. But it gets to a good point that I've said many times on this, but I'll say it one more time. Our national government, if we're giving assistance, for instance, to the banks, unlike what happened in 2008, need to give relief to the mortgage holders, these landowners that are the landlords of many of our small businesses, and they in turn need to give help to our small businesses. I believe the same thing should happen for rent forgiveness for our residential tenants as well. But if you look at the numbers, there's no way a business improvement district or even the city of LA would come close to but a small fraction before we would be bankrupt. This has to come from the big packages that are coming out of Washington, D.C. We would be held liable, but they can make that mandate since they regulate the banks, and I think that's the right place to do it. Thanks for the question, James. Next question.
Our next question comes from the line of Eric Hines from CBS News Service. Please go ahead.
Hey, Eric, how are you?
Hi.
Go ahead.
I'm sorry, if you could 10 again, please.
I think you got to press 10 one more time.
There you go. And your line is open, Mr. Hines.
Hi, Mr. Mayor, can you hear me?
Yes, I can hear you great.
Okay, fantastic. I was just wondering if you had a number on the volunteer medical workers who have signed up through the portal, and also what kind of work they're doing currently, if they're going to be part of that mobile coronavirus testing unit, and any other details on that program.
Yeah, I just got briefed on this today. I don't know what the full number is. I'll see if I can get to you by the end of this. It was 3,750 something a few days ago. It might be well north of that. Plus, of course, there's the California Medical Corps that the governor put forward that had over 100,000 people signed up already. We've now started going through that list together with partners who need this to relieve our testing centers, to help us out at the convention center where we're setting up hospital beds. So we anticipate that when that gets going in the next week or so, that there will be folks from Medical Corps that help us in the testing centers, any spillover places for standing up new beds, including perhaps helping at St. Vincent's when that opens up. So we know that there's a shortage of medical personnel right now. We've got a wonderful database, but it does require some background checks. It requires a few things that we are speeding up as quickly as possible. It's not quite enough to say, hey, I'm here. When people's medical care is on the line, you have to go through a couple more hoops. But we do anticipate putting the first of those folks to work this coming week. And I'll try to get you an overall number by the end of the press conference. Thanks. Next question, please.
Okay.
Our last English question comes from the line of Elizabeth Chow from LA Daily News.
Hi, Liz.
Go ahead. One moment, please.
Okay, so I have some questions. I know that you've already answered some potentially about the shelter in
Sure.
Granada Hills.
Yep.
Okay, so my first question is, what is the purpose of the trailers parked outside the Granada Hills shelter? Are they for the employees, as I've heard, or workers? The other question I have is, are there concerns about the air filtration system at the Granada Hills shelter? And has that been brought up with city staff? And the other question I have is, I think you've actually mentioned this idea yourself of commandeering hotels. Are you thinking about revisiting that idea, considering maybe some of this, what's happened at the shelter? And I guess I wanted just to tack on the question about what you are doing and regarding what people would go after being at motels and hotels.
Okay.
Thanks.
Great. Thanks, Liz. So in Granada Hills, no, trailers are there available if people need to isolate quickly. In these cases, we're able to, I think right now, put people pretty quickly into hotel and motel rooms, and that's what was done in this case. As I said, there's more capacity than patients for that right now, though we expect that to quickly ramp up, which is why we need more and more hotel rooms. In terms of the air filtration system, no, that's not been brought to my attention. We have public health there, so we'll take any guidance from them, but we don't expect to need to have air filtration systems. I mean, in any place, we're not putting special air conditioning in. People have their temperature taken before they go in there. It's safer than the street, and when anybody does exhibit symptoms like we found there, a test is given. If they're positive, they're taken out of there, the place is cleaned, and you reset it. So the system is working exactly like it's supposed to, so that people don't die on the streets, don't spread on the streets, and it spreads from the streets to everybody else as well. In terms of the more hotel rooms, we can't have enough of them, and we can't have enough of them quickly enough. In terms of my powers, I've said I have the power to commandeer them, but to be clear, the charter says we must pay for them too. So this has always been a funding issue. When I said over 2 years ago, we need a FEMA-like response to our homelessness crisis, I begged the state and the federal government to bring those sorts of resources in so we could house people quickly. It took this crisis, and I'm very thankful to FEMA, saying finally that we can reimburse for these hotel and motel rooms before somebody's sick, before the disaster hits them. In the past, it's only after an earthquake and people are homeless, or after a disaster or fire, that then FEMA will permit that. That is a remarkable change, and one that gives us a real hope in taking many more people off the streets. But as I announced last night, I've put kind of a czar on this, John Vane, who is the president of our Convention and Tourism Commission, so he knows many of those hotel folks. He's talking to them and trying to get even more deals as quickly as possible with the state and the county. And then finally, in terms of the exits, I've said it almost every night, but I'll say it again. Shame on all of us if we collectively let all these folks that we're going to take off the street simply go back to the street. We know not 100% of them will go into housing, but if we can get hundreds or even thousands more than we would have because we've brought them into someplace safe where they've articulated in so many cases, they feel safer, they have a meal, where they're starting to feel more human, they can take showers, they can be clean. We need to have an army of folks and the funding for it. If the federal government says good luck, goodbye, if the state says way to go, here's a few dollars, we will have lost the most important opportunity. And you will hear me talk about this with my fellow mayors up and down the state, that we really want to partner with the federal government. This is an amazing opportunity. Maybe some of these hotels and motels want to sell to us permanently, and we can turn that into housing. But we need staffing for them as well. You can't just put people in a setting and say homelessness is over. People who have needs from job training to childcare to mental health and substance abuse issues, you have to actually get them those services. And I've always said the solution to homelessness might piss liberals and conservatives off. Liberals because you could finally move people off the street if you had enough beds, and conservatives because you have to pay for it up front. But if you do that, you don't have to pay for this crisis every single year. And so I hope this is not a crisis that we will let go to waste, and I certainly am going to lean in very hard on this throughout this crisis and when we declare victory on COVID-19 to make sure those folks are brought home permanently. Thanks, Liz. Last question, I think, in Spanish, or next
We do have a follow-up question from the line of Steve Gregory from KFI News.
Okay.
Please go ahead.
Go ahead, Steve.
Hey, Eric, real quickly, I know you want to get to Spanish.
Don't worry.
Do you have an update on the crisis response team and how many contacts you've made with non-essential business still open? How's that working out? Are you seeing the improvement in that area? Thank you.
We've had great outreach. It's over 1,500 contacts. It might be over 2,000. The last briefing I had was over 1,500 contacts. Visits, now close to 1,000. And a very small percentage, 92% of them comply. The 8% that then we need a little bit more of touch with, almost all of them comply. And then it's really been just a few dozen where we've had to either bring LAPD and or bring some sort of prosecution. The latest number I had was 8 charges, but I don't know what the latest ones are. Let me see if I can find that out for you as I answer the next questions as well, okay? But it's been working really well. And as I've said with all this, people ask this about masks, people ask this about our outreach folks. We really depend on people's self-enforcement. We are here to supplement that and to send a message that we will come after you. So I did get the number, by the way, on the medical volunteers for that question. It's 4,296 people who have now signed up. I'll take the next question. Thanks.
And our only Spanish question comes from the line of Abel Alamillo from Telemundo 52. Please
Hola,
go
Abel.
ahead.
Hi, Mayor. How are you?
Good. How you doing?
Good, thanks. Just wanted to know, in regards to the day-to-day COVID-19 cases, we saw that they declined considerably in the last 24 hours in LA County. Do you credit the safer at home orders for that decline?
There's no question in my mind that this is your victory out there, that this decline in the increase, and by the way, we can see still larger numbers each day, but the decline in the increase is the result of people staying at home. So this, to me, that we've had 4 days in a row with single-digit increases, that's not good. We're not going to be good until we have negative increase or a decrease. But that said, in the meantime, it shows that what we're doing is working. It's not time to let up. It's not time to declare victory. It's not time to come out. It's time to double down. It's time to stay home on Easter. It's time to not go out and as often as you can, stay at home instead of going to the market. If one person has to go, send one person, not the family. It is evidence to me that this is working. I'll say that as well in Spanish. Estos números son increíbles y son el resultado de sus acciones. Y gracias a la gente de Los Ángeles, porque la reducción en el aumento de casos es el resultado de su visión, de sus acciones, y también es una reflexión del alma de Los Ángeles. Segundo, es importante no declarar una victoria, porque tenemos más y más casos cada día. El aumento es reducido, pero los casos en total están creciendo. Y necesitamos tener días donde no hay un aumento. Este será una victoria. Pero ahora es un tiempo para doblar su trabajo, doblar su presencia en su casa. Y es importante también por toda la gente tomar estas órdenes en su corazón, en sus acciones, en una manera seria. Porque nosotros podemos salvar vidas de nuestras familias, de nuestra comunidad, donde continuaremos con En unas semanas o unos meses nosotros podemos declarar una victoria, pero estas es buenas noticias. Con esto, I'm going to speak a little bit of Spanish now too. Thank you to everybody in English. Strength and love to you all, and thank you for tuning in. Muy buenas tardes a la gente de Los Ángeles y gracias por estar aquí esta noche. Sé que estos son tiempos muy difíciles, pero quiero que sepan que yo y su ciudad estamos aquí para ayudarle. Primero, la información que usted necesita. Hoy hubieron 425 nuevos casos en el condado de Los Ángeles, llegando a un total de 7,955. Este es el aumento más bajo que hemos visto, pero aún agregamos cientos de casos nuevos. Esto significa que sus acciones están ayudando, pero todavía tenemos días difíciles por delante. En la ciudad de Los Ángeles tuvimos 227 nuevos casos, llegando a un total de 3,587. Y tristemente, hoy fallecieron 25 personas más en el condado, llegando a un total de 223. Nuestro amor está con todas las familias de los fallecidos. En nuestros hospitales tenemos 1,641 camas disponibles. Entre ellas, 268 están en las unidades de cuidados intensivos y tenemos 971 respiradores disponibles también. Hoy hicimos pruebas de detección para 4,300 personas en nuestra ciudad. En total, 33,000 personas se han hecho la prueba en nuestros centros y estamos en camino para doblar ese número a 60,000 la semana que viene. Si tienes síntomas de coronavirus, visita la página coronavirus.lacity.org/testing para hacer una prueba de detección ahora. Pero también sabemos que hay personas quienes necesitan hacerse una prueba, pero no pueden salir. Entonces, esta noche estoy anunciando que la ciudad lanzará un equipo móvil de pruebas de detección para instalaciones alojando a las personas mayores con enfermedades crónicas o comunidades de vida asistida. Lanzamos una página para ayudar a estos lugares a acceder a estos servicios, coronavirus.lacity.org/assisted living testing. Mi orden para la protección de trabajadores entra en vigor hoy a la medianoche, la cual indica que los empleadores deben ofrecer coberturas faciales para sus empleados, la oportunidad de lavarse las manos cada media hora, sanitarios limpios y medidas para implementar la sana distancia. Además, todos quienes entran en un restaurante, hotel, mercado, taxi o un sitio de obra en construcción o servicio de entrega deben llevar una cobertura facial. También les recuerdo que los servicios municipales siguen en operación. Esta noche estoy anunciando que el Departamento de Servicios Sanitarios ofrecerá colección adicional de contenedores gratis, temporalmente para los hogares individuales y pequeños apartamentos. Si tienes una bolsa de basura o reciclaje adicional, espera afuera para recibir el camión cuando llega. Manteniendo siempre la sana distancia, espera que vacíen el contenedor y después llénalo de nuevo con la segunda bolsa y camión se lo llevará. Este servicio es gratis para residentes. Empieza el lunes hasta que acabemos la orden Más Protegidos en Casa. Si tienen preguntas, llama a 311. Además, para continuar a proteger a nuestros animales y personal, empezando el lunes 13 de abril, cerraremos nuestros centros de servicios para cuidado de animales en el Valle Oeste y Centro Norte. Van a mover los animales a uno de los otros centros que quedan abiertos, Valle Este, Harbor, Chesterfield Square y el oeste de Los Ángeles. Si quieres adoptar una mascota, visita la página laanimalservices.com/adopt o llama al 888-452-7381. También quisiera ofrecer progresos sobre nuestros Mayor's Fund de Los Ángeles. El jueves, nuestros centros de recursos familiares distribuyeron $1.2 millones en tarjetas de regalo para supermercados a 10,000 familias que las necesitan. Si pueden donar para ofrecer más a estas familias, por favor visita mayorsfundla.org para contribuir. Tenemos que hacer todo lo posible para apoyar a nuestros héroes y podemos empezar con decirles gracias. Esta noche estaremos iluminando el ayuntamiento de color azul para expresar nuestro agradecimiento para ellos. También participarán el Centro de Convenciones, el Aeropuerto, LA Live, el Coliseo, el Centro Músico, el Centro Staples y el Estadio de Bank of California. Y ustedes también pueden participar con abrir sus ventanas o pararse afuera y aplaudir esta noche a las 8. Con una voz y una acción, expresamos quién somos en Los Ángeles. Quédense en buena salud, quédense protegidos y quédense en casa. Fuerza y amor, Los Ángeles. Thank you all so much. We'll see you tomorrow.